Good day to you. My name is Chelsey. Welcome. Today, I'd like to touch on a few steps that help me discover the right surgery procedure for me. Up until my diagnosis, and even after I was diagnosed, I had absolutely no idea how many different procedure options were available, including reconstruction and not. So today, I'd like to share a few things that really help me work through the decision-making process to find the right fit for me. My tumor was located deep within my breast. So for me, this meant that I was going to have chemotherapy before surgery. And for me, this was both a blessing and a little bit of a curse. On the upside, it did give me some extra time to research and connect with the surgery team that was going to be right for me. I actually made a whole video on this process with some tips for you. I will tag it above, and I would recommend watching that video before this one if you're just getting going with surgery. The challenge for me with having chemotherapy first was that it gave me a lot of time to agonize over the decision that I needed to make, which was which surgery procedure was going to be the right one for me. And to be completely honest with you, I battled with it for about 4 months. I went into a state of depression over it because I was in absolute mental turmoil, and I didn't end up making my decision until I was pretty much forced to, which was 2 weeks before my surgery. Making this decision was extremely hard for me because, as I mentioned in my last surgery video, I didn't realize the role that my breasts and pec muscles played in my overall well-being. And all of a sudden, I was faced at a crossroads where I needed to make a decision that was going to impact both my life, my longevity, the use of my body, as well as so many other things. And it was very challenging to pick one surgery over another where there were both positives and negatives to both solutions. So I wrote them down because there's a list. So a few of the thoughts on my mind revolved around recurrence, maintaining the feeling of my breasts, future body health, body function, what my breasts would look like, recovery, future life using my body, infection, breastfeeding, safety, and the various technique options available to me. So as you can imagine, not everything is going to point to one specific surgery, and that's the part that I really had a problem with. How was I supposed to know what was best for my body in that present moment, as well as moving on for the rest of my entire life? It seemed and felt and is a massive decision. So I'm curious, if you've already gone through this decision-making process, was there anything that really helped you decide? Or was it quite streamlined for you? Did you just know what option was right for you? I'm curious if I'm the only one that had a really hard time with this. I did struggle to it, but I am here as living proof to tell you that making a decision is possible. So let's get to the 6 steps that really helped me look within and get the information that I needed to make the decision that was best for me at that time. While I did rely on feelings to make my decision, I also found it extremely valuable to rely on facts. I went with a bunch of questions to my 2 surgeons and my oncologist and got them all out there. I wanted to know different percentages for recurrence, how things would feel, how things would look, what life after surgery would be like for different options, and really figure out the nitty-gritty behind the surgery and what it would mean for myself and my body. I found getting those straight facts from people who are based off of science was extremely helpful to give me kind of a backbone and a foundation to be able to make my decision from there. I do want to add for this, I'm a massive questions person, as I've mentioned before, and I do tend to ask too many questions, but I am also in the belief that there are not too many questions. I took up too much time, but I needed to take up that time in order to get the information that I needed to make the decision that I needed. So don't be afraid to come with your list of questions. And even if you can see the professional getting a little bit antsy because you're taking a little bit longer than maybe you should, that's okay. You are entitled to know what is going to happen to your body, how it is going to affect you in the future. So ask away, and if they get a little bit squeamish, that's okay. It's important for you to know. I found it very comforting to connect with warriors and survivors who had had surgery before me. It was really helpful to gain a little bit more of a personal perspective and insight into what the surgery options were like based on their experience. They were able to give me a little bit more information on things that professionals hadn't experienced in most cases, such as how it was going to feel in my body, what it was going to look like, and the use of the body after surgery, which were really valuable insights to have in my experience. So if you have someone in your life that you can connect with and be able to ask those more personal questions, I would highly recommend reaching out to someone that you are comfortable with and someone that is comfortable sharing. And I found it really helpful to learn about what surgery options other people chose, as well as if they were going to go through it again, would they choose the same option? Of course, when you're reaching out, be gentle. There are some people who would definitely be comfortable sharing, but there are also people who want to keep their experience close to their hearts. So just be aware and respectful of that. What I recommend is taking time to slow down when you're in your decision-making process. I found walks helpful, going for hikes or extended periods of time just sitting outside alone. I found taking long baths very helpful, looking at my body and really connecting to it and seeing what emotions come up. And I found slow restorative yoga sessions or stretching, just that time to be quiet with my mind and my body, allowed me to work through my emotions and connect with my thoughts. During the time that I was trying to make a decision, I was blessed to be able to connect with a friend of mine who performs Reiki. And she gave me a really interesting and helpful technique to use visualization to help come to a decision. So for me, I was deciding between two different surgery options, and I was really torn between the two. So what they recommended was, if you're deciding between 2 or 3 different surgery options, pick one. Pick that option and sit with it and visualize yourself how that feels in your body. Visualize yourself going to the hospital, getting prepped for the surgery, heading into the operating room, imagining yourself with that one surgery choice. Imagine yourself waking up. Feel the feelings that come up within your body and just let yourself sit with that one surgery as if it is the decision you made for a few days. Then change in your mind and choose the other surgery that you have in your mind. Once again, visualize yourself going to your surgery, going into the operating room, seeing how you're feeling within your body, just taking note if maybe one or the other is feeling a little bit more right or comfortable for you. Then assess. I found that this was really helpful because I did notice some different feelings when I really gave into whatever surgery I was trying to see if it was the right one for me. When aiming to make this decision, my brain was on absolute overload. It would dart between my many concerns, then it would fixate on one and forget the rest, and the next day it would change completely. I found that it was very hard to stay focused and grounded when my brain was trying to process all things at once. Something that really helped me was connecting with friends or family and talking about specific things that were on my mind and maybe things that I didn't know about. So one thing that was on my mind was breastfeeding. So I reached out to some of my breastfeeding friends to hear their perspective on it and the importance it plays in their lives. Taking the time to talk to someone and verbalize my thoughts really helped me focus and regain my composure and sometimes lose my composure. But it really helped to ground me and bring me back to thinking in a solid line and kind of gaining back control over my thoughts. The other thing that I found helpful is if I wasn't comfortable talking about that thing, writing it out, pulling out just a journal or a random piece of paper and writing down my thoughts and concerns. And I truly find that once it's down, once it's out, it takes away that power that it has over my mind, and it allows me to reground, refocus, and think a little bit more clearly. Know that this decision has to be yours. This is your body, your life, and your future. Don't be afraid to go against the grain or against the trend to pick a surgery that is right for you. There are so many factors that weigh into the type of procedure and surgery you choose and how it affects your body and your life. So make sure that you're making the choice for you. Make sure that you are looking within to find what is right for your life, your heart, and your future. Let's do a little recap. When working through the decision-making process to find and decide on the right surgery procedure for you, take time to be alone with yourself and alone with your thoughts. Try that visualization technique that I mentioned, where you visualize yourself making different surgery decisions and seeing how it feels in your body. Don't be afraid to ask the professionals all of your questions to gain the insight that you need. Remember that there are survivors and warriors out there who can give you a little bit more of a personal insight into the experience and what life after surgery will be like. If you're feeling jumbled, try talking about a concern with a friend or writing it down in a journal or a loose piece of paper. And in the end, the choice is yours. Listen to your body, your mind, and your heart, and know that you have the power to choose what is best for you, your life, and your future. My heart is sincerely with you. This is not an easy step in my experience, and I just want you to know that I believe that you will make the decision that is right for you. You'll have the surgery, and soon enough you will be on the other side, working to recover and get on with life. Thank you so much for being here with me today. I sincerely hope that these ideas will be helpful for you in making your decision. If you enjoyed this video, please give it a thumbs up. If you'd like to join me again next time, subscribe and hit the notifications bell for more breast cancer insight videos. I wish you all the best. Take care, and we'll see you next time.